Hello, everybody. Good afternoon. Welcome. It is Sunday, June 14th, and I am your happy, healthy Dr. Alicia. So today I'm going to have a very, very exciting discussion with Nubia E Martin. And she's going to join us. She's a midwife who's going to speak to us about why birth options are important, especially for women of color. So give us just a few minutes while she logs in and comes on to join us. Hope everybody's having a good Sunday. It's such a beautiful day in New York. Hi, Nubia.
Hello, greetings. How are
How
you?
are you?
Good. You look beautiful.
Thank you, as do you. Thank you
Thank
so
you.
much.
Thank you.
Oh my God, I'm super excited to have this conversation. Like,
Yes.
super. Thank you so much for joining me. So, Nubia and I actually have a mutual friend,
Yes.
Mila, who you guys all know. For those of you who tune in every Sunday, I'm always raving about her because it's so important for people to have doulas when they go into birth. And even as a physician, I always say, like, I would have never gone into my birth experience without an advocate,
Yes.
somebody who knew exactly what I wanted, what I didn't want, and somebody who could speak on my behalf when I'm really trying to redirect all my energies inward so I can bring forth new life, right?
Right.
But yeah, so I just want to introduce you because you have amazing credentials and have so much knowledge to share with us today. I'm super excited. So everybody, this is Nubia E Martin. She's a community birth worker and founder of Birth from the Earth Incorporated, which is a nonprofit organization that provides health education, empowerment, and wellness services to women. And of course, they also help women to deliver their babies outside of the hospital setting, right? So that includes birthing centers and also in the home.
Yep.
So, yes, where do we start with this? Well,
Um,
first, can you tell us a little bit about, for those people who don't know, like what is a midwife and how are they different
yes.
from a traditional birth worker, i.e., an OBGYN? I shouldn't even say
Right.
traditional because they're not traditional, but go ahead.
Right. Right. Well, thank you so much for having me. And I mean, I think first and foremost, what I'd like to say, is that I consider myself a community birth worker. So yes, there's, credentials and letters and titles and all of that. If we break it down, I worked as a birth doula for many years. I'm a
Hmm.
certified birth and postpartum doula. I'm a lactation consultant.
Hmm.
I have a bachelor's degree in sociology. I have a master's degree in midwifery.
Hmm.
I am the founder of Birth from the Earth. However,
Hmm.
I feel like besides all the titles, it's about what purpose do you serve?
Right.
Like, how
Hmm.
are you serving the people? So I always say I'm a community birth worker because I encompass many different roles. Sometimes that role is student, still always learning. Sometimes it's teacher.
Hmm.
Sometimes it's provider. Sometimes it's catching a baby. So
Many
but
roles, right?
I'm merely a vessel. That's what I
Hmm.
always say.
Hmm.
And I do a lot of call and response to
Hmm.
kind of find out what the community wants, what they need, and that changes over time. But one thing that's been constant since I've been doing this since 2008 was we want to be listened to. I think that's the
Hmm.
biggest thing. And this pandemic has really amplified the fact that we have not been, listened to and that we deserve quality care.
Hmm.
And that looks, different, in different communities. But, um, and where we get that care might be different based on what our desires are, what our needs are, what our health status is. But that's
Hmm.
the basic bottom line is we deserve that. So,
Hmm.
my journey started I mean, the call to midwifery started when I was young. I would
Hmm.
sneak in to look at my mom's copy of Ina May Gaskin's Spiritual Midwifery because I was like wrapped up in the stories, there.
Uh-huh.
And but there were images of naked ladies giving birth, so I thought I was supposed to hide and feed them. But I was drawn to that.
Uh-huh.
And I'm the mother of 5 children, so
You go, girl.
the
I know you got your hands full, boo. I
yes,
have one, and I'm like, help me. Calling on the spirits.
Yes, yes. And 5 complete different personalities for sure.
Uh-huh.
So that's always fun. But
Uh-huh.
the birth of my oldest, my daughter who turned 18, which I can't believe, on Friday,
Hmm.
really kind of, you know, showed me that, okay, this was not where I was supposed to birth. So I was in the
Mm-hmm.
hospital for my first two, but that there has to be a better way of supporting physiologic birth and
Mm-hmm.
natural birth as opposed to intervening.
Mm-hmm.
And
Mm-hmm.
of course, sometimes intervention is necessary.
Mm-hmm.
And I totally, believe in medical intervention when there is a medical reason. And I'm
Mm-hmm.
grateful for medicine when we need it, because
Mm-hmm.
it does have to be a balance. But most times it's not needed.
Mm-hmm.
So I, believe in fostering physiologic birth.
Mm-hmm.
And after having my first two in a hospital setting, I went on to have my last three at home with midwives, which was
Mm-hmm.
like the turning point for me, and knowing
Mm-hmm.
that this is what I wanted to do,
Mm-hmm.
for other families. Yeah.
Mm-hmm. Man, amazing. Yeah, I, started also my pregnancy journey hoping that I would be able to deliver in a birthing center.
Yeah.
But of course, about the 24th, 25th week, I developed gestational diabetes. And I was like, no, my dream was slowly fading away
Yeah.
to deliver
Yeah.
in a birthing center. And then, of course, the preeclampsia during the labor, which, I was grateful that I was able to deliver in a hospital setting. But,
Yeah.
I made that decision consciously, which I feel like a lot of women, and obviously my doctor obviously was like, no, you have to do it here. Like, that's just what it is.
Right.
But the fact of the matter is, I was aware that other choices existed for me.
Yeah.
So, and kind of speaking about birth agency and birth choice today,
Mm-hmm.
why do you feel like it's so important for women to understand what their options are for birthing?
Right. Well, I think, before we even get into options about birthing, before we
Mm-hmm.
even get into pregnancy,
Uh-huh.
conception, health
Oh,
is
yeah.
so important, right? And I
Uh-huh.
think many people don't think about that. Once they're pregnant, it's like, oh, I want to make sure I'm eating right and I'm doing all this, and that's great.
Mm-hmm.
But if we think about, the period beforehand, if we're really planning a pregnancy, to try to do all that we can to make sure that the things that can complicate a pregnancy, like gestational diabetes or
Mm-hmm.
anemia or hypertension, that we're, addressing those issues through diet, through lifestyle changes. And of course, sometimes there's nothing that, can be done, but we
Mm-hmm.
can try to be, preemptive as opposed to reactionary, I think, when
Mm-hmm.
we
Mm-hmm.
talk about preconception health. And then, in terms of where and how we birth, I think it's so important, because the way in which a woman or a birthing person is made to feel when they're bringing forth life stays with them forever.
Oh, yeah, absolutely.
Whether it's beautiful,
Absolutely.
positive experience, or whether it's, less than desirable, the way
Yes.
she was made to feel when bringing forth life stays with her.
Right.
So that means really kind of tuning into yourself and seeing what's important to me. For some
Mm-hmm.
people, the safest place that they feel they need to give birth is in a hospital, right?
Mm-hmm.
And that's from pre-existing health issues. That could be just that's their comfort space.
Mm-hmm.
Other people, you know, think that home birth is the best for them, because they know that home is where they're going to feel the most at peace. And if
Mm-hmm.
they're with qualified providers, they feel safe. They feel that, things can unfold without, any negative adverse event. And then
Mm-hmm.
other people want to have a happy medium, which would be a
A
birth
birthing
center.
center.
But we don't have enough birthing centers, right? So that's been the issue for many, many years, that if somebody does not want to give birth in a hospital, they are low risk, but possibly home is just not conducive for them.
Mm-hmm.
We just don't have enough birthing centers. So we have many birthing centers within hospitals, which
Mm-hmm.
isn't exactly the same.
Yeah.
We don't have enough freestanding birth centers, and we
Mm-hmm.
definitely don't have midwifery led women of color, people of
Yes.
color, led
Yes.
centers. So
Yeah.
that is what we're trying to move towards, because when we're doing the call and response with the community, that is what they want. They want providers
Yes.
that look like them. They want
Mm-hmm.
providers that are culturally competent. They want providers where they're not going to have to worry about implicit or explicit biases, right?
Mm-hmm.
And they also want to be able to be an integral part of their care.
Mm-hmm.
That's first and foremost very important. And there are OBGYNs that I know who do that, who
Yeah,
sure,
absolutely.
absolutely. But I also know that when you have a practice that has a lot of people coming through, or a clinic where a lot of people are coming through, it's hard to balance the time constraints with being
It
able to
is.
address everybody's questions. So that's, so it's not, I don't think it's intentional all the time, to just
Right.
dismiss the person, but I have a full panel of people to see how am I going to get to everybody if I spend an hour, with each person. There's not enough time.
Absolutely. Absolutely. There are so many kind of demands that are brought
Yeah,
upon our time as physicians working in the traditional healthcare system today. It's unfortunately, patient needs really take a back burner to trying to meet all of these administrative demands,
right.
which make it very difficult to concentrate on the patients in front of you. So I definitely kind of understand that piece of it as well.
Yeah,
Um, so you mentioned how important it is to have midwifery-led freestanding birth centers.
yeah,
Can you talk a little bit about, and also midwives of color. So can you
yes.
talk a little bit about why that's important,
Yeah.
especially having birthing centers where access to those services are available for low-income women as well as women of color?
Yeah, sure. So, first, when I think about just having birth centers that are run by midwives, we haven't had that because there were laws where that couldn't happen, right?
Mm-hmm,
Birthing centers could only be opened and run by physicians.
mm-hmm,
And we went to Albany year after year and
mm-hmm,
lobbied and tried to make a case for why we felt that midwives
mm-hmm,
should be able to open and run their own birth centers. And we were
mm-hmm.
met with a lot of resistance. Well, what's the problem with doctors opening them? Well, they don't. They don't open them. That's the problem. Um, so now that we have, got that, bill passed and, still working out the whole, you know, the actual plans for how that can come to fruition, we have a lot of, providers who've just been waiting for that to be able to, offer that. Um, for me, and I think it's great. I think we need many birth centers. So I don't feel
Mm-hmm.
like, there's going to be one birth center that's going to answer everybody's needs. No, there needs to be a variety of different ones with different philosophies and different models of care.
Mm-hmm.
Specifically for the one that I'm involved with helping to plan, it is important to me that the majority of the staff and the people behind it are not only people of color, but providers of color who have been doing community work for a while, right?
Mm-hmm.
So
Mm-hmm.
not somebody who's just like, oh, this looks like something that I want to jump on the bandwagon. No, somebody who can who needs to be steeped in this work, because that's important that we don't just come into a community and say, oh, this is what these people need,
Yeah,
right?
it's not like experimental.
Exactly.
Like we're not
Exactly.
looking to just try things out on people.
Right, right. And we also want it to be, a center that engages the community birth workers who've been doing this with
Mm-hmm.
no accolades, no pats on
Mm-hmm.
the back, not for recognition, not for likes. They do this because they are
Yes.
invested in their community and serve. And they've, forged relationships with people in their community. So the people trust, right? So we want to be able to incorporate them in the process as well.
Mm-hmm.
Um, so yeah, being able to walk into a facility or a birth center where you see people that look like you, that maybe have had some of the same struggles that you've had, I think that's important.
Mm-hmm.
Yeah.
Yeah, absolutely. I mean, I always tell people that, the therapeutic alliance is so powerful with patients that even before they walk in the door, just especially, since I am a family medicine doctor, I see
Yeah.
children and adults alike, and really to
Okay.
see children walk in, and even before you say anything, just like, hey, how are you all doing today?
Right.
Children are like,
Yeah.
I even had one little girl tell me, oh my God, it's the real life Dr. McStuffin. She was
Aw.
so cute, and she had
Yeah.
her little doctor bag with her with Dr. McStuffins on it, and she's like,
Yeah.
"Can I have something for my bag?" And it's just
Yeah.
so cute to really see that like connection with the community as
Yeah,
well. So
and
I
they
think
do
it's
need to
super
see real
important.
live Doc McStuffins. You know what I
Yeah.
mean? Like they do. They need to see, it's nice that we have, an animated image, but
Yeah.
we need to see real live, people in these roles because they are out there. And,
Hmm.
with the profession of midwifery in America, it's a challenge because the profession is 95% white.
Yeah.
So there's already a severe lack of midwives of color.
Hmm.
And I believe that's directly correlated with our high maternal mortality morbidity rate, just
Right.
right? Because
Yes.
we just, there's a number of factors that play into that, but the fact that we do not have an abundance of midwives of color, that student midwives suffer. My experience was not, just a linear, oh, I went to midwifery school and it was I mean, that's a whole nother live that we can we can do another time.
Yeah,
But
just about like training, right? Like
just
medical
about
training.
training and the process of, these systems in America that are all steeped in, implicit biases, and the education process
Absolutely.
is definitely not exempt from that. Yeah.
Yes, absolutely. You're absolutely right about that. I mean,
Yeah.
definitely. And it's not to say that, white providers can't also provide, high quality care to women of
Right.
color, but, definitely having a diverse workforce that really kind of understands the communities in which they work, because implicit bias is real, that people
Right.
carry these very kind of deep seated stereotypes about individuals, about
Hmm.
communities that can be very harmful
Right.
in their health outcomes. And I am
Absolutely.
so sorry for all the sirens, everybody. It is still the COVID era in
That's
New York
right.
City.
Yeah. Yeah.
So it just
This is
is what it is.
reality. Yeah.
I know. So I also just want to, highlight the very important point that like having birth for low risk women outside of the hospital setting is safe. Because I know that for people who are considering that, that's always like their kind of apprehension. Well, is this safe?
Right.
Is it for me?
Mhm.
So can you kind of talk about, talk to the issue of safety a little bit, and like what goes into like making a decision to have a birth outside of the home?
Sure. Yeah. So I always tell people that with home birth or with any, setting that you're going to think about, you really need to, do your deep dive into, is this the best thing for me? And in
Mm-hmm.
terms of being low risk or high risk, about 85% of pregnancies are low risk, right?
Mm-hmm.
And evidence-based, if we're going to talk about, evidence, which everyone loves
Yes, boo.
evidence-based,
We
right?
got to.
Evidence-based shows that out of hospital birth is actually safer than in hospital birth.
Yes, it
However,
is.
98% of births take place in the hospital.
Yes.
Why? Because people just don't have that information, I think, many
Right.
times.
Right.
Um, they are just indoctrinated to, oh, I'm pregnant, I'm going to go to a hospital to birth. But for many, many hundreds of thousands of years, we were not birthing, in hospitals.
Mm-hmm.
So I think that idea of, is it safe, is a big one.
Mm-hmm.
I think people sometimes have an idea that midwives just come with, like, towels, and they boil water, and you know, and
And they
that's
bring a
it.
bowl, yes,
Right.
and they're like,
So
put this on your head.
right, So one of the big questions that we were getting during the whole pandemic was, well, can you guys still do an epidural in the home? No, we cannot do an epidural in the home. No, we cannot do a C-section in your home. No, there is no pain medication. However, we have oxygen, we have lidocaine, we have all the other, things that are necessary. But we're also, in your home, it's just us with you. So there's not many people that we're caring for. And for myself personally, I, attend births with a co-midwife. We
Mm-hmm.
have a birth assistant, and that's because I've always historically looked at the way that people give birth. There's always been two or three,
Yeah, there's always
attending,
lots of ladies around.
right,
Yeah,
right.
providing
So this
support.
is not work that we're supposed to do, in a vacuum by ourselves, right? This
Right.
is work that we're supposed to do together. And that way, we're able to consult with each other if we need to.
Mm-hmm.
We're able to provide care to mother and baby once baby is born, because we have a second or sometimes third set of eyes, ears, and hands. So
Mm-hmm.
I think that's important that people understand that.
Mm-hmm.
That we are monitoring, throughout the labor, depending on what stage of labor you're in. We're
Mm-hmm.
checking your vitals. We're listening to baby's heart rate. We're checking your progress. And
Mm-hmm.
when I say checking progress, that doesn't mean necessarily doing a vaginal exam, because sometimes people who have been used to birthing in the hospital are like, well, when are you going to check
They
me? When are you
get
going to
an
check me?
exam every hour. You're like, why?
Yes. And if
Again?
they've been used to giving birth in the hospital, that's the thing. Well, how come you're not checking? And I'm like, I can tell by your body language. I can tell by your, the sounds that you're making. I can tell by the frequency and intensity of your contractions, what's going on. I don't have to. If I am checking, it's because I need vital information, right? So that's why I'm going to check.
Yeah.
But we want to reduce the risk of infection.
Mm-hmm.
I'm a very hands off, hands poised type
Mm-hmm.
of provider, as opposed to let me get up in there and see what's going on.
You
you
don't
know,
necessarily need to. The woman's
that's right.
body really does the work on its own, especially when it's in an environment that is conducive to comfort, to
Oxytocin
positivity.
flowing. Yeah,
Yes, to get everything flowing and all of that.
right.
So since you did mention evidence-based, I do want to put forth some of the data because I know people are
Yeah.
like, well, what are the numbers, right?
Right. Right.
So there was actually a huge study that I found in the Journal of Midwifery and Women's Health, a
Yeah.
very reputable journal that shows
Mhm.
that where they looked at 17,000 women. So that's a lot of women
A
who
lot.
had a
A lot.
planned outside of hospital birth, right? So
Yeah.
of these 17,000 women that wanted to give birth outside of the hospital setting,
Right.
89% of them were successful in doing that safely. That's very
That's a
high.
big
So
number.
it's like
Yeah.
a very high success rate
Yeah.
of out of hospital birth. 94% of those women had a vaginal birth without any issues, and 1% did have an assisted vaginal birth, right?
Okay.
And there were, of course, there was an 11% transfer rate to the hospital, but that was usually due to the fact that women weren't progressing as expected with their
And maternal
pregnancies.
exhaustion. I would say that's the
Oh
number
yeah,
one reason
yeah,
that,
people are just
because they're
tired.
not progressing and it's been,
Mm-hmm.
maybe several days or prodromal start stop labor.
Mm-hmm.
So most of the time it's not like oh my gosh, we emergency have to transfer and fly out of here. It's
Mm-hmm.
the family makes a decision that she's tired, she's been at this
Mm-hmm.
for a while, and it's not a emergent transfer for sure.
Mm-hmm.
Yeah.
And the C-section rate among these women is 5%.
Okay. Wow.
So when you compare that to the overall C-section rate in this country of in-hospital birth, which is around 33 to 35%, and
Yeah.
then you factor in that Black women are more likely, 40% more likely to have C-sections, that's pretty incredible. And C-section
Right.
is a major surgery, people.
That's
This is
right.
not like, oh, let me just have a section and be done with it, and I ain't got to do no work. No, there's plenty of work that
Right.
your body has to do to heal itself,
Right. And when we think about just the numbers in terms of causes for maternal deaths, right?
Mm-hmm.
So the
Mm-hmm.
number one right now is like heart issues, cardiomyopathies.
Uh-huh.
And when I look at that, my question always is, well, why would a woman in her 20s and 30s be having congestive heart failure or
Yeah.
cardiomyopathies? But when I look at the fact that, we know Black women are dying way more, right?
Right.
Our heart chakras. We have gone through some of the worst atrocities that you can imagine, and we have
Mm-hmm.
never had a space to really unpack those things, heal from those things, recognize those things. I mean, we, still have J. Marion Sims, the father of gynecology, who,
Oh yeah.
was practicing, surgeries without anesthesia on these
Oh yeah.
women.
Criminal, barbarian.
Right, right. So our heart chakras are deeply wounded. So it does not surprise me that we would have heart issues that you probably would not expect to see unless somebody's in their 50s or 60s or upwards because of the epigenetic DNA and our cellular, DNA and trauma that we've dealt with that we've never had the space to heal from. So that's what I always think about with the heart issues. But then all the other reasons are related to operative birth, whether we're
Mm-hmm.
talking about infection, sepsis, hemorrhage, deep vein thrombosis, pulmonary embolism. All of these are related to surgical birth, to C-section.
Mm-hmm.
So
Mm-hmm.
if we were to address our C-section rate, right,
Mm-hmm.
that
Mm-hmm.
would address a huge chunk of the problem for, women of color and Black women and us, dying.
Mm-hmm.
But I mean, let's be real. We know America is a country that's steeped in profit over people, right?
Mm-hmm. You
So,
know it.
especially certain
The
people.
capitalist
Um,
society.
so, C-sections also generate big money.
Yeah, they do.
That's another thing. So when I have somebody who maybe is on the fence about home birth and they're like, I don't know, I feel like, hospital is safer. I tell them, well, you really want to research that hospital. Look at their rates. Look at what their overall C-section rate, their primary C-section rate. Do they allow VBACs? Do they have midwives on staff, right?
Mm-hmm.
Because that's important. And when you look at the numbers, hospitals that do have midwives on staff have a lower overall C-section or primary C-section rate and a higher VBAC rate. Most
Mm-hmm.
hospitals that have no midwives on staff have very high C-section rates. And sometimes it's simply because they just have not seen enough physiologic births to really trust that process, that it can
Mm-hmm.
happen without being induced because you're a day over your due date or because the baby is suspected to be big and all these things, not
Yeah.
for medical reasons. So
Mm-hmm.
we're jumping to inducing. Inductions sometimes fail, and
Yeah.
then the baby is in distress. And now we're doing a C-section that comes with a whole bunch of other complications. And then it also is going to impact this birthing person's future modes of delivery sometimes as well, right?
Mm-hmm.
So there's so many things to unpack here, but I think going back to, just giving people choice about where they, plan to give birth, the important thing is providing them factual information so that they can make an informed decision. If you're telling
Absolutely.
somebody that, oh my gosh, well, if you try for a VBAC, your uterus is going to rupture. Okay, well, let's put it in context. We're talking about less than 1%, right?
Mm-hmm.
If you give somebody that extra little piece of information, that's going to change their whole, reasoning behind, should I attempt a VBAC or should I go for my second or third C-section? But if you just tell them your uterus is going to rupture, well, no, I don't want my uterus to rupture. So
Right.
yes, please cut me open, save my baby, get my baby out of me. But there's harder recovery time. There's increased chance of cutting vital, organs. There's all that scar tissue that you have to go through. So there's increased risk with repeated C-sections as well.
Mm-hmm. Mm-hmm. Absolutely. And I know that both you and I are part of a very exciting initiative, which is that we
Yeah.
are or helping to organize around the opening of a new birth
Yeah.
center in the
Yeah.
Bronx,
Yep.
Riverdale part of the Bronx, called the
Yeah.
Birthing Place Bronx. So
Correct.
we're super excited about that.
Yeah.
Can you speak a little bit to to the birthing center and kind of what's
Go ahead.
happening with that?
Yes, yeah. So we mentioned earlier, Mila Flores, right?
Mm-hmm.
Wonderful, amazing birth worker. We've been talking about this for over a year now, for a while, and just kind of had a plan and an idea, and we've been expanding and reaching out to other birth workers, other women of color, other community members, to kind of find out what it is that they want and how we can bring this to fruition. Um, been receiving some flack about the fact that it's going to be in the Riverdale section of the Bronx. And I'd like to address that because I'm not one to just, oh, let's shove that under the rug. Who cares? I want people to understand the reason why that's
Mm-hmm.
where it's going to be. So some of the flack that we received behind that is that, well, Riverdale is not really the Bronx, and people of color aren't really wanted there. And my rebuttal to that is, actually, Riverdale is the Bronx. And
Okay, looks like we have a little bit of difficulty here. We're reconnecting. Guys, hopefully you all can still. Okay, so I think we lost Miss Nubia, but she'll be coming right back because she was just dropping some gems for us just now about why birthing center in the Bronx is so needed, and about the Riverdale community in the Bronx as well. So she's going to join us to reconnect. Okay, we got you
I
back.
got kicked out. You see, as soon as I started to get to the nitty gritty, like, nope, dead that, abort. Every time. I kid you not, but every time. Um, so where was I before they cut
So
me
you
off
were talking
again?
about how people were
The
saying, oh, the
Yeah,
Riverdale's not really the Bronx. Like, people aren't going to want people of color to come
right,
there. Like, why
right.
would you put a birthing center there?
Yes, yes. So I was saying that even though they have cordoned off a section of the Bronx and manicured it and made it beautiful and it's really affluent, does not mean that we, one, don't deserve to be there and that we're
Mm-hmm.
not going to be there, right? So
Mm-hmm.
one, we have access to a property that's there, but that is not the only reason that we're doing this. Doing this because I feel we do need to infiltrate that section of the Bronx, because it's like, how dare you have this section that you have cultivated and made, beautiful. And then you have like areas in the South Bronx where it looks like you're still back in the 80s. So
Mm-hmm.
I understand that, yes, it's going to be a little bit of a culture shock for most of the
A little
Riverdalians,
bit.
right? For most of the Riverdalians, to see, a
I
variety
like
of
that,
people there.
Riverdalians.
However, that's going to be a culture shock that they're going to have to quickly adapt to, because I feel that we have every right to be there.
Mm-hmm.
And I want us to be able to have a birthing center in a location that is safe for us to go to, that is, beautiful. And that's important, to me. I grew up in Yonkers. I can walk right into the Riverdale section of the Bronx from where I live. I worked in the Riverdale section of the Bronx. That's Wave Hill for 11 years. So I know the climate out there. However, if we wait to build birth centers in areas where we're quote unquote wanted, we'll have none, because spoiler alert, we're not really wanted anywhere. Okay. So we have to reclaim we have to reclaim it. We have to reclaim it, and it's our right to do so. And, in terms of access, the beautiful thing about this location is it has so many modes of access to get there.
Yeah, it does. Uh-oh, it looks like we have connectivity issues again. The universe is conspiring. Oh, okay. We got you back?
Hold on. Am I still there? Yeah.
Yep, you're here. You're with us.
I don't know if that's now my connect. I don't know what it is, but every
technology.
time I get to this point, I'm telling you, when I get to this point of the talk, this is how it goes. So yeah, we have many ways to get there. And we also, we're starting with this. This is going to be the main location, but the idea is to also have, satellite and extension centers in other areas that need it. So this will be where people come to give birth, but if they need care, we might have a place like in the Mott Haven section of the Bronx, in Mount Vernon, hopefully, because we don't have a lot of those centers there. In Yonkers, I would love to have, an extension center. And what we were talking about is, it's not just going to be a place just to give birth, but it will be a wellness center, right? So we will have classes, workshops, we'll have opportunities for community. I think coming off of this, pandemic and being, what's the word, sheltering in place and secluded, we're going to have to reintegrate, into community, and we're going to have to do a lot of healing, and we need to do that together. We're stronger together. And I know, there's so many things that try to divide us, and even amongst, ourselves as people of color, there's a lot of divisions. It's enough of that. Like, we have to come together because we are stronger together. So, when people have brought up the thing about it being in Riverdale and them not being on board with that, I'm like, well, let's have a conversation about it, because I don't want to just be like, okay, well, if you're not down, you're not down. No, we need everybody.
Everybody needs to support.
So let me explain to you why it's here, and then tell me and tell me what we can do to make that feel more comfortable, So, and if that means making the people of Riverdale a little uncomfortable, well, guess what? It's time that we get uncomfortable.
Hey,
frankly,
it's just time. So, it's just the climate.
Yeah.
Everybody's a little uncomfortable. Time to get used to it.
And we need to be. We need to be. Yeah. Because if you're comfortable with the things that are currently happening in our world, then I'm looking at you like, really? You okay with that? Okay. Well. So yeah, we should all be uncomfortable and working towards better. For sure.
Yes, absolutely. Well, oh my God, Miss Nubia, thank you so much for your wisdom, knowledge, positivity, all your work.
Thank you for inviting me, and thank you for
your
work too.
Thank you so much. And everybody, the Birthing Place Bronx is currently fundraising for the Birthing Center, and they're seeking matchers for their fundraising efforts. So if you want to give a small donation, you can always visit Birthing Place Bronx PX, which I pinned down below, their Instagram page, to get the link to make a small donation. And if you're interested, small or large, yes. And if you're interested in being a matcher, you can also reach out. You can DM the Birthing Place, Birthing Place Bronx as well, to express interest in becoming a matcher, as we are kind of going into our early stages of fundraising, but are looking for people who are willing to provide extra support so that the Birthing Center can become a reality.
Yes.
All right. Should we just do a roll call real quick and see if there's any questions, concerns, thoughts? We had so many people join us. What's up, Tip77, Artwork Creative. We have Why They.
Yeah, we have Y to G. Yeah,
YBG,
Y to
yeah.
G.
We have Letty Liriano. Hello, Marquise Scott. Okay, it doesn't look like there's any questions,
Okay.
but if you all have any questions, you can definitely feel free to reach out to myself at Happy Healthy Dr. Alicia, or you can reach out to Miss Nubia Earth Martin, and she is at Birth
From the earth.
from the
Yep.
Earth. Yes. Okay.
Yeah.
All right. So if there isn't any other questions, Nubia, did you have any last thoughts?
No, I just want to say thank you so much for having this platform because I feel like, these conversations need to be had. Some people just don't even know why we should have a birth center. And
Yeah.
I would love for people to, think about their own birth experiences, their own birth stories, and,
Mm-hmm.
what worked, what, didn't, what would you have liked to see differently?
Mm-hmm.
What would you like to see for your next pregnancy or your daughter's, pregnancies? These are
Mm-hmm.
things that we want to hear because the call and response is continuous. So it's
Yeah.
not like, okay, we know what they want and we're going to build it. And that's, no, it's a constant, constant conversation, constant community engagement. It's very important. So, and, there are going to be many different roles within the birth center. So we're also hoping that once we are up and established, that student midwives, who are coming up, who might need some hands-on experience, can be a part of, giving back to the community, childbirth educators,
Mm-hmm.
different types of trainers. So if you have skills, you have something that you want to offer, let us know because there are many different ways to contribute. It doesn't always have to be financial. We know that
Mm-hmm.
everyone's going through, a lot of stuff with coming off of this pandemic. And we also know that some people just got it like that. So if you have it like that, beautiful, help us out. But there are many ways to help, and your skills and your presence,
Mm-hmm.
is very important. Yeah.
Awesome. Beautiful last words.
Thank you. Thank you.
Okay, everybody. So that concludes our weekly Sunday edition of our IG Live series, talking about all things related to women's health, particularly as it pertains to women of color. Thank you so much for joining, and
Thank
we will see you
you.
all next week.